Divine Pay, we are starting two interesting series. One is a patient journey series where I take you over different kinds of plastic surgery results of patients who have trusted us, and we show you the journey of the patient from the pre-operative period to the on-table situation and post-operative results which have been taken from 3 months to say 6 months. So this gives you an entire perspective of how the result shapes up. So see the videos that I've been making specially to show the patient case series journey. And now we are also starting a second series, which is the TDR series, the Teach, Demystify and Reassure series. So basically, I'm going to talk about different procedures where I'm going to talk to you about what you should know. Second, what you should not know. That is the demystification of myths that you are carrying. And the third, reassurance, where we are talking of the problems of plastic surgery, the complications, and how you are more safe and how you can maintain more safety. So the first I'm going to talk about in the TDR series is about blepharoplasty. So keep watching. So we are starting with the TDR series. The first situation we are taking is eyelid surgery, also called as the blepharoplasty. In part 1, this is the teach part. About the eyelid surgery that you must know. First, I'm going to talk about the upper eyelid in this series. Why does somebody want a surgery? So basically, the skin folds come here and they fall down and the eyes can get covered or the eyes are hooded. And patient feels that in pictures, the eyes look very heavy. Sometimes fat bags are also visible here and there's excess of skin which makes you look old. And that is the reason why patients undergo the eyelid surgery. Almost everyone can do eyelid surgery as long as there is no bleeding disorder and you are not on any medicines related to the heart and any other serious medical problem. So there is no limitation in terms of that. All these surgeries can be done under local anesthesia. You do not need a general anesthesia for these surgeries. So how do we start? We identify what is the extra skin. So usually towards the outer side, we have to make an incision like this to cater to the extra skin. And this goes here. This distance is usually about 6 to 8 mm from the eyelashes. So these are the hair here. So this distance is usually 6 to 8. Sometimes it can be more also. Then we go on till the most inner part, turn slightly angular like this, and then we decide how much of skin is to be removed by pinching. So we basically pinch, pull and see that there is no tightness. So all of this skin is then removed as you're seeing in the video as well. So the incision, basically the surgery starts like this. We give an incision here, lift this off, and this comes out. And then below this, there is the muscle here, which is the orbicularis muscle. Then we make a small opening in the orbicularis muscle like this. Inside is the fat and we take it out. Then we make a small opening here. Inside is another bit of fat. We take this out. And then finally, once this is done, we close the two ends with very fine stitches, and these stitches get invisible in about 3 months time. After that, you can barely see the stitches. In the post-operative recovery period, 3 weeks, no exercise or sports, stitches removed after 7 days. That is all that you need to know. Of course, painkillers and antibiotics need to be taken. In the part 2, the demystify, I'm going to talk to you about various myths that patients carry about eyelid surgery. 1, it makes you look unnatural. No, in fact, it makes you look much younger with a more normal pair of eyes. Second, it makes you look hollow. No, it doesn't. Absolutely not. If it is done properly, it does not make you look hollow at all. In fact, it makes you look rejuvenated. 3, it cannot be combined with the lower eyelid. If you have problem on both the eyes, it can definitely be combined with both of them. 4th, it changes the shape of your eyes. No, absolutely not. If properly done, properly planned, there is no change in shape of the eyes. And 5th, it is a very long recovery. Again, absolutely wrong. In as soon as 7 to 8 days, you can actually be back in office. In part 3, the Reassure series, I'm going to talk to you about how you can take out the fears of eyelid surgery. So I've already taught you about what is the eyelid surgery, some myths which are important which needs to go away, and third, reassurance. One, see, if you are with a plastic surgery team which has immense experience. Now, I did my MBBS in 1994, finished it in 1998. I finished my plastic surgery in 2008, way before most plastic surgeons in Delhi even started their journey. So, if someone is senior, has a lot of experience, then the problems percentage decreases significantly. And even if there is a small problem, then we know how to handle it because of the large amount of experiences. So simple problems like symmetry or bleeding or infection. Now, these are extremely rare, can so easily be tackled as long as your operating doctor is experienced. So my suggestion to reassure you is that always choose doctors based on their experience and skill. Read about them, read about their seniority. Don't be led away by anyone saying that they are senior and whereas they are not. And always check which institution they have done their training in. Better institutions produce better doctors. You must keep a track of all this.